Chances are you didn't think twice about the last prescription you picked up at the pharmacy, trusting that the medicine in the bottle matches the information on the label. After all, America's drug supply is the safest in the world. Millions of people buy life-saving medicines every day. But tonight, a dose of reality. As more and more drugs are being sold on the internet, a new problem has emerged: counterfeit medications. And now those fake prescription drugs are popping up at drugstores. They look so real, even pharmacists are being fooled. Chris Hansen has a Dateline hidden camera investigation.
Sherry, how are you? Lovely to see you.
You are undercover in China with Dateline's hidden camera.
Hello.
Waco?
Yeah.
This woman is telling us how her company is making and selling millions of doses of counterfeit medicine around the world.
You got Britain, Italy.
Yeah.
As you'll hear tonight, she wants me to become her newest partner, selling bogus medicine in America.
So we could do 6,000 a day.
Yeah.
She's part of a growing and illegal business that threatens you and your family. Part of a murky underworld Dateline found that could contaminate some of the medicines you take every day.
I honestly don't think the public appreciates the magnitude of the problem involving counterfeit medicines.
Millions of prescriptions are filled each day without a problem. But experts say if you've never thought about the safety of your prescription medicine, it's time to think again.
In terms of a public health risk, where does this rank?
I think it's very high. This is a crime that can kill people.
Aaron Graham has fought counterfeiting with the DEA, the FDA, and private pharmaceutical companies. He says fake medicine is showing up not only on the increasingly popular internet, but also at local pharmacies. It can look real, but often there's no real medicine in it. Just ask the Blount family of St. Louis, Missouri.
Oh, he's so big.
They've already discovered that counterfeit medicine is a very real and growing threat.
She was a fighter. She always was a fighter. She never complained.
Ed and Maxine Blount were married for 29 years and raised 6 kids.
Come on, Smokey gets a stick.
Tina is their youngest.
She's funny. She loved to play practical jokes. She was such a great mom.
But suddenly, after a visit to the doctor, the family got bad news.
The biopsy shows she's got breast cancer.
Breast cancer?
Yes.
Maxine had surgery, but a year later, when the cancer returned and spread to other parts of her body, she began a grueling course of radiation and chemotherapy.
No matter how much of a fighter you are, that treatment takes its toll.
It takes away your strength, and it takes away your desire to live, more or less.
But doctors said there was a medicine that might help.
I asked my doctor about Procrit.
Maybe you've heard about it on TV.
Procrit is for chemotherapy-related anemia in patients with most kinds of cancer.
Procrit can't cure cancer, but it can give people the energy to help fight it.
So how did Maxine respond to this Procrit?
She responded real well because she knew she was going to have 3 or 4 real up days.
She said, how great it made her feel. She didn't just physically feel better, she mentally felt better too.
So you could see the difference?
Definitely.
Maxine was getting the highest strength, a vial like this injected once a week. It cost $500 a dose, quite literally worth its weight in gold.
It was worth it because it gave her life. It gave her something to live for.
So the doctor would prescribe it.
Yep.
You'd go to the pharmacy, pick it up, you'd take it to the cancer clinic, and they'd inject her.
Right. That's exactly how it worked.
The medicine gave Maxine the strength to do things with her family, including her daughter's new baby, Sadie.
She loved to see her.
And the Procrit helped your mom have the energy to play with her granddaughter.
Mm-hmm. It did.
But suddenly, mysteriously, the Procrit seemed to stop working. Her family wondered, was the cancer taking over? But then a nurse at the cancer clinic made a shocking discovery. Their latest batch of Procrit, including this bottle, was counterfeit. It wasn't real, and there wasn't enough of the active ingredient to have an effect.
I mean, the labels look legit, the box looks legit, it's got a lot number, expiration number.
To a common person, you go down to the drugstore and pick that up, it could be full of water. You wouldn't know the difference. We had no idea that what we were getting and having administered wasn't the good stuff. How could we know?
What surprised us and what may surprise you about this case is that Maxine and her family followed the government rules you've heard. They didn't import the medicine from Canada. They didn't order the medicine over the internet. They got the medicine the way most of us do, from a trusted local pharmacy.
Prior to this, had you heard anything about such a thing as counterfeit prescription medicine?
Never. But I never, ever would have dreamed that someone was counterfeiting it. You know, just taking advantage of someone who's already terminally ill is, I can't even conceive it.
So how did it happen? These records obtained by Dateline show that before Maxine's medicine arrived at her drugstore, drugs from the same batch were bought and sold by a series of drug wholesalers and distributors in Texas, Arizona, Tennessee, Florida, and New York. Along the way, someone slipped in the counterfeits. And Maxine Blount wasn't the only victim. The bogus medicine ended up in well-known drugstores nationwide, including CVS. Investigators discovered that a phony prescription drug ring run by this man, Jose Grillo of Miami, operated undetected for nearly a year, selling as many as 11,000 boxes of counterfeit Procrit to wholesalers nationwide and pocketing an estimated $28 million. And what other medicines are counterfeiters targeting?
If you take the cholesterol-lowering drug Lipitor, you may want to check that bottle.
Even the top-selling prescription drug in America, Lipitor, had to be recalled when counterfeits from Central America were discovered in drugstores across the country, including Rite Aid. Another phony prescription drug ring had operated for more than a year before someone even noticed the fakes. We rarely think to look for them.
If I'm sick to begin with, that's why I have the prescription. Now I get the counterfeit medicine. Now it's subpotent, so I'm not getting better. The first thought the doctor has is not, oh, you must have a counterfeit drug. It's the drug's not strong enough, it's not the right drug, you have a different illness, so let's treat it differently.
And because bogus prescription drugs can be so difficult to detect, no one really knows how many Americans there are like Maxine Blount, who suffered because her medicine was fake.
That Procrit was her only hope of being able to enjoy some prime time, because without it, she had nothing. She got part of her life stolen away from her.
When you're dying of cancer, time is precious.
Special.
And this was the medicine that was supposed to make those moments tolerable for her.
And within a few months, Maxine Blount was dead, and an entire family felt robbed. When you hear a story like that, where the stakes are so high, you want to know more. Who's making the bogus medicines? How do they sneak them into the very heart of our medical system? And could we find some of the illegal counterfeiters? The search for answers would start at a computer keyboard and take us halfway across the world. A year-long journey deep into the world of international counterfeiting, negotiating deals we never imagined.
Coming up, counterfeits so convincing they can fool even the experts.
Is that close enough to fool the average pharmacist?
If you aren't looking at them side by side, it's very difficult.
That's frightening.
It is frightening, you're right.
And wait till you hear what's in them when our hidden camera investigation, Bitter Pills, continues.
She didn't do anything wrong. I mean, she got her prescription from her doctor and she went and had it filled.
Maxine Blount of Missouri was bravely battling cancer when her family discovered that one of her medicines was counterfeit. Now her family is speaking out, hoping to warn others.
This is all part of it. I know she would want us to do this and to let people know what happened to her and that it can happen to them.
Dateline wanted to find out more about the counterfeit medicine business. Where are the bogus drugs coming from, and what are the loopholes that let them reach the shelves of neighborhood pharmacies? So we went to a man who has investigated counterfeiting cases all over the world.
They seized these teddy bears that contained 40,000 dosage units
40,000
of counterfeit Viagra.
Aaron Graham has investigated counterfeit drugs for the government and the pharmaceutical industry. He shows us cases right here in America where counterfeit medicine has been smuggled in and eventually sold to neighborhood pharmacies.
He was selling to wholesalers, actually, in the United States.
How much of this stuff got in neighborhood drugstores?
It's my understanding that more than $500,000 wholesale price of this particular drug went to pharmacies.
$500,000.
That's right.
That adds up to more than 70,000 doses of medicine. You might think that medicine goes straight from the factory to your pharmacy, but there's actually a complex network of wholesalers who buy and sell surplus medicine. All it takes is some phony paperwork and some realistic packaging to let fake medicine slip into the system and be shipped to local pharmacies nationwide. And criminals know it.
We've seen Russian organized crime, we've seen Chinese triads, we've seen Colombian cocaine traffickers, we've seen the Mexican mafia, we've even seen the Hells Angels counterfeiting and smuggling medicines.
So you've seen Mexican and Colombian cartels that are now both doing cocaine and prescription drugs?
Absolutely.
Example. Julio Cruz, a convicted cocaine smuggler. Federal prosecutors say he was one of the ringleaders in the group that made that fake Lipitor and sold it to drugstores and mail-order pharmacies throughout the United States. And where are the bogus medicines being made? Graham showed us some examples.
Look at these conditions. I mean, this is just not what any patient in America expects.
This is a cave in China where those pills and the teddy bears were made.
Pretty scary conditions.
And it gets worse. These are pictures of a counterfeiting operation in Colombia, making both prescription and non-prescription bogus medicines, complete with yellow road paint as one of the ingredients.
This is the product coming out of there. This is the coloring bowl. This is the cement they use. This is the lead-based highway paint to provide the coloring.
So in this case, not only is it counterfeit, but it's dangerous.
Incredibly dangerous. I mean, boric acid will cause renal failure in humans.
After seeing conditions like that, we wanted to know more about the counterfeit medicine business. So Dateline decided to go undercover, posing as businessmen interested in buying and selling phony drugs. The first step, setting up our own company, Hansen Group, with a simple web page.
Hey, this is Steve at Hansen Group.
We set up a phone with an answering machine and a mailbox where we could get deliveries. Then we went online to a series of business-to-business bulletin boards. We won't tell you all the steps, but experts told us the best way to start would be to look for ads for Viagra, thought to be one of the most counterfeited drugs in the world.
From Bombay, India, regarding the U.S. brand medication.
And before long, by telephone,
This is regarding your request for various pharmaceuticals. Thank you.
And by email, we begin to get offers, including this one. We can supply the goods. It comes from a Chinese woman who calls herself Sherry Wong.
Every month we have sent to America.
Over the phone and in emails, she didn't mince words. This business, she told us, is illegal.
It is not illegal for us to do this business.
But high profit. She agreed to send us a sample of her pills, not only Viagra, but two other popular erectile dysfunction medicines, Cialis and Levitra. At first, the pills and packaging looked so good, we wondered if they might be genuine, the same medicine sold less expensively overseas. To find out for sure, we took the Viagra to the testing lab at Pfizer, the company that makes the real Viagra.
So you have to look for the more subtle differences.
Right. John Thomas is Pfizer's expert at identifying counterfeits. Usually he can spot a fake right away. But with these pills, it's hard to tell, even when they're side by side with the real thing.
Those are actually quite good.
If these pills are fake, Thomas says, they're some of the best counterfeits he's ever seen.
Is that close enough to fool the average pharmacist?
If you aren't looking at them side by side, it's very difficult.
That's frightening.
It is frightening, you're right.
It will take a sophisticated chemical test to tell for sure.
Now you can see very clearly that there are significant differences in it.
In the end, the chemical fingerprint proves the pills are fake. And even though they look good, you may be surprised to find out what's inside them.
We have probably a tablet composed principally of gypsum or drywall material.
Yeah, same stuff that's in drywall.
Basically, it's very similar, right. Yeah.
You heard it right. Although they contain some of the active ingredient of Viagra, the pills on the left are mostly drywall, but they look good enough to fool almost anyone.
How would you rate it, though, as a counterfeit?
An excellent counterfeit.
And although he's testing our fake Viagra today, Thomas knows from experience that counterfeiters worldwide are also targeting other medicines. He showed us some recent examples, fake medicines that wouldn't work.
This is a collection of some of the materials we've had recently.
Aricept for Alzheimer's.
Aricept is a particularly unfortunate case.
Norvasc for blood pressure.
Again, no active in this particular counterfeit.
No active ingredient?
No active whatsoever.
So if somebody's taken for their blood pressure, they're not getting it?
No effect.
Lipitor for cholesterol.
It has no active in it whatsoever.
And for an elderly person or a person with a heart condition where it's critical to keep the cholesterol down, that could be fatal.
That is dangerous, correct.
So who's making the fake pills we bought? Some of the best counterfeits experts have seen.
I have a very big customer in Los Angeles.
To find out, Dateline keeps negotiating with Sherry Wong. Remember, she thinks we're businessmen interested in buying fake medicine and selling it in America.
It's very convenient to send the goods from China to United States.
To prove we mean business, we place another order, this time for 1,000 pills. And just as Sherry promised, they sail through customs undetected. So we decide to try something rarely attempted. We're about to meet an illegal counterfeiter face to face.
Coming up, Dateline goes undercover and around the world to infiltrate the counterfeiting business. We'll show you how easy it is to cut a deal.
Cheers.
When our Dateline hidden camera investigation, Bitter Pills, continues.
We've been negotiating over the internet and the phone for 11 months, and now we're in China to find out how hard it would be to ship counterfeit pills into the United States. Pills that could end up in your neighborhood pharmacy.
The Chinese government frowns on investigative reporting, but we went anyway with our hidden cameras rolling.
Hello, sir. Do you like a watch?
It's a country famous for knockoffs.
Rolex?
You like I give it cheaper.
But on this trip, we're not looking for fake Gucci or Rolex.
Sherry, how are you? Lovely to see you.
Okay.
She may not look the part, but this young woman says she's the chief salesperson for one of the biggest counterfeit pharmaceutical operations in China.
Did you fly in?
We meet her and her assistant in the lobby of a modern Chinese hotel. Remember, Sherry Wong doesn't know I'm a reporter. She thinks I'm a businessman interested in buying fake medicine.
I like your hair, Sherry.
Yeah.
I like it.
Yeah.
After some small talk,
Hi, guys.
we move to a private suite where we can talk serious business. We've wired the room with 5 different hidden cameras.
So, the quality on the test shipment was extraordinary.
To remove any doubt about who made such high-quality counterfeits, we ask her directly.
But you actually make it, right? Your company actually does.
Yeah, our factory made it.
Yeah.
Sherry Wong says her company makes better counterfeits than other Chinese companies. Fake medicines good enough to sell to distributors all over the world.
You got Britain, Italy,
Yeah,
Australia,
France,
Japan, France,
America.
and America.
And take one guess where she sells the most.
Out of all those, America is the biggest purchaser.
Yes.
Since the fake pills don't have to have real medicine in them and don't have to pass safety tests, they're cheap to make. Sherry's charging us $1 a pill instead of $8, the regular wholesale price for the real medicine. But since her pills look good enough to pass for the real thing, we can sell them at a huge profit.
Our company were very, very busy.
So just how large is her counterfeiting operation? To find out, we ask how many pills she could smuggle into the United States undetected. The numbers are even bigger than we imagined.
How much do you think we could ship?
One time?
Yeah, at a time.
I think the biggest quantity is, I think, with better 6,000.
6,000?
Yeah.
In one shipment?
Yeah.
And how many shipments per month do you think we could do?
Every week, 6 times. Every day, 1 time.
So we could do 6,000 a day?
Yeah.
She says she'll do it with packages like these, using popular commercial shippers. In order to avoid detection, the fake pills come in small packets, just like the ones Sherry sent to us. They're heavily bubble wrapped and taped, with the bottles and the fake labels shipped separately. But now, instead of 1,000 pills, she's telling us how she can smuggle 6,000 pills a day. That's 1.5 million pills a year.
It would not be a problem then to do 6,000 a day, 5 days a week, 30,000 pills a week. So that's, 120,000 pills a month.
You can do it?
Well, we're getting very close on our end. If you can do it, we can do it.
Okay.
If we finalize the deal at retail prices in the United States, a year's shipment of counterfeit pills would be worth $10 million.
I mean, it's a lot of money.
Yeah.
But during our meeting, we discover something else. Sherry's company isn't stopping at Viagra. She tells us they're working on more fakes, including the cholesterol drug Crestor, the prescription cream Vanica, and the weight loss drug Xenical.
So in other words, you can make the raw material for all this, Crestor, Vanica, Tomidux, and Xenical.
Yeah.
But not finished product yet.
Yeah.
In the future, you think you can do finished product, though?
In the future, I think we can do the finished good.
But just when we thought we'd heard it all, Sherry Wong tells us something else we'd never imagined.
We would be selling these to stores, to drugstores, so we need to make sure that the packaging is the same as Pfizer's. For instance, if Pfizer changes the packaging, do you know, so you can change as well?
Our lab in America,
right?
They always give us the newest information.
Could that be true? The counterfeiters have a lab in America? We wanted to find out more. So to keep our conversation going, we promised to keep working on our multi-million-dollar deal.
Let's do it.
We shake hands and have a meal to celebrate.
Cheers.
Coming up, the medicine used as the best defense against bird flu. Are criminals faking that drug too?
How often have you shipped to the United States?
I ship 200 every day.
When our Dateline hidden camera investigation, Bitter Pills, continues.
It's a new front in the war on drugs, counterfeit prescription medications sold at local pharmacies. And these pills aren't exactly harmless. As we've seen, ingredients range from cement to drywall to highway paint. So how are they finding their way into the heart of our medical system? Dateline has gone undercover to track the counterfeiters who may be putting lives in danger. The trail has led all the way to China and back. Here again, Chris Hansen.
Chinese counterfeiter Sherry Wong thinks I'm a businessman about to seal a multi-million-dollar deal to buy her fake medicines. We've been negotiating over the internet, over the phone,
Every month we have sent to America.
and now face-to-face in China.
We can produce more than this quantity.
So you could do even more than that.
Yeah, even more.
But she's telling us things that seem hard to believe. She's boasting about her company's lab in America and about her customers worldwide. Could it be true? Or is Sherry just exaggerating, trying to make a sale?
Out of all those, America is the biggest purchaser.
To find out, we showed our tape to Aaron Graham. Remember, he's worked undercover investigating phony prescription drugs all over the world.
She seems very articulate, eloquent, and she's excited to meet you.
And excited to do the deal.
And to do business with you. That's right.
But her biggest customer is in the United States.
I believe that's true.
And what about the fake medicine Sherry wants to sell us? Could it really be resold here in the United States?
Do you think we could find a middleman who would ultimately sell these counterfeit medicines to to a neighborhood drugstore.
Well, I hate to say it, but it wouldn't surprise me.
So we keep negotiating, trying to find out the location of Sherry's American lab and who's really in charge of her counterfeiting operation.
It's nice. Not too sweet.
It is nice. Yeah.
At a lunch to celebrate the prospect of our multi-million-dollar business deal, Sherry begins to relax a little and tell us some secrets about her company.
One is the biggest boss.
She tells us her boss is a Chinese-born scientist who actually lives in the United States and worked for American drug companies.
He had worked in America for more than 10 years.
Really? Did he work for one of the drug companies? Or?
Yeah.
Remember, Sherry knows all too well that the fake medicine business is illegal. She even wrote it in an email. So we doubt she'll tell us much more about her boss. But it never hurts to ask.
What's his name? Oh, you don't have to know. I mean, don't.
But by now, Sherry seems to trust us. Not only does she tell us his name, Dr. Lowe, she even spells it for us.
L-O-U.
In this follow-up email, she gives us even more detail, saying he worked at a company called Advanced Syntech, then founded his own company called Pharmaron.
Dr. Lowe? Dr. Lowe, Pharmaron?
Yeah.
How are you? Chris Hansen with Dateline NBC. I'm a correspondent.
Oh, yeah.
Dateline checked records and discovered that this man, Dr. Buyang Lowe, a scientist living in Louisville, Kentucky, had founded a research lab called Pharmaron. Before that, he'd worked at Advanced Syntech, where he got this patent. He seemed to match Sherry's description until we started asking about fake medicines.
But do you have a company in China that is making products like these? Cialis, Viagra, other medicines?
No, they don't.
You do not?
No.
You're positive?
Positive.
In this country, Dr. Lowe is a respected scientist, so it makes you wonder, could Sherry Wong be making it all up, using his name to make her business sound bigger than it is? We were about to discover that we weren't the only ones who wanted to know more about Sherry Wong. How big of a player is Sherry Wong?
We don't know right now. She has a source of supply for a number of different products, not just Viagra, and she has customers in countries around the world.
John Terrio is Vice President of Global Security at Pfizer, America's biggest pharmaceutical company. He's in charge of a team of investigators trying to track down counterfeiters all over the world.
I'll see you up in the suite.
After we returned from our undercover meetings in China, we discovered that Terrio's team was in the middle of its own sting, trying to take down Sherry Wong's entire operation.
We thought she was a fairly important player, but we really didn't have any idea where she was, and we didn't have any idea of what organization she might be associated with.
While Pfizer investigates, we keep on digging, going back to the internet, searching this time for a medicine that could be the difference between life and death.
For sustained human-to-human transmission, it could spread quickly across the globe.
If the deadly bird flu ever becomes a worldwide pandemic, as some experts fear, the medicine that will be the frontline defense is Tamiflu, made by the Swiss company Roche. We wondered, are counterfeiters taking advantage of bird flu fears by making fake Tamiflu? And if so, how hard would it be to find the fakes?
How often have you shipped to the United States?
I ship 200 every day.
The man on the other end of the phone calls himself Nick Yin from China. On his website, he claims to have genuine Tamiflu and other medicines including Plavix, Zenical, Norvasc, and Lipitor. All, he says, in bulk quantities.
I can ship 3 kilograms each time, about 5,000 boxes.
5,000 boxes?
Yes.
And you've done that successfully to the United States?
Yes.
We order a sample of his Tamiflu, and before long it arrives, hidden in an express mail envelope. Inside, one package with 10 capsules. The box clearly says Tamiflu by Roche, just like the real thing. It is sealed and stamped with a code number, just like the real thing. In the blister pack inside, the capsules themselves are off-white and yellow, with the word Roche imprinted on each one, just like the real thing. To the naked eye, this life-saving medicine looks legitimate. And Nick Yin says he's selling a lot of it to America.
Yes, I mainly sell to your country. You don't need to worry.
But when Dateline sends the Tamiflu to Roche, the manufacturer, to be tested, the company says it is actually counterfeit. Look again. Would you have suspected this medicine is a fake? And if not getting the medicine you need sounds bad, consider something worse. Imagine terrorists getting involved in counterfeit medicine.
We've had testimony on the Hill that Hezbollah is counterfeiting medicines to fund their terrorist activities.
Aaron Graham, the former undercover counterfeit investigator, says when he heard that 600,000 doses of fake Lipitor had turned up in American drugstores back in 2003, the first thing that crossed his mind was, could it be a new kind of terrorist attack?
God forbid somebody had intentionally, with malice, introduced an adulterated and dangerous medicine. And that morning, everybody got up and took their Lipitor. And people started falling over. That's what went through my mind. It still goes through my mind, frankly. Very scary.
Coming up, can counterfeiters be stopped? There is a remedy.
They can use this device to actually read the bottle.
When our Dateline hidden camera investigation, Bitter Pills, continues.
Hi, guys.
In a Dateline hidden camera investigation, Chinese counterfeiter Sherry Wong sold us some of the most authentic-looking fake pills experts have ever seen.
Those are actually quite good.
But we're still trying to find out who's in charge of Sherry Wong's operation. Pfizer's chief of security, John Terrio, wants to know, too.
We were trying to work the food chain both into the United States to find out if she had a network here and also back up the food chain in China to find out who was manufacturing the product.
While Pfizer expands its investigation, we continue our own, trying to find out more about this man, Dr. Buliang Lo, the Chinese-American research scientist Sherry Wong claims is her big boss.
This is a complete nutshell.
When we first met him, Dr. Lo flatly denied having anything to do with counterfeiting and said he didn't even recognize the name of Sherry's company.
What about that? Is that familiar to you?
No.
Sherry Wong told us she worked for a Chinese company called Cixi Kamba Pharma. Dateline found and translated these business records from China, showing that Cixi Kamba Pharma was actually formed by another company, Beijing Kamba Pharma. And whose name appears on the board of directors of that company? Dr. Buliang Lo. Dr. Lo lives on White Blossom Boulevard in Louisville, Kentucky. Look closely. You can see his address written in English on the official Chinese company records. What's more, for several years, his wife was listed as the company's biggest shareholder.
Let me just show you.
So last month, we went back to Dr. Lo to ask him about the records that seem to raise more questions than they answer.
So these are the documents filed with the Chinese government for Beijing Kamba Pharma, okay? Mm-hmm. And these are the members of the board, which include you and your wife, right? Yeah.
When we showed him the official documents, Dr. Lo told us his family had started the company, but he and his wife severed their ties to it in December 2004, before Dateline ever met Sherry Wong or received her shipments.
We just dissolved this company a long time ago.
But your family started this company?
With my brother.
With your brother?
Yeah, it's no longer existed.
Later, in a phone call, Dr. Lo told us he suspected a few years ago that the company might be selling raw materials that could be used in counterfeits, and told his brother to stop it immediately. Dr. Lo says he's no counterfeiter. He's a victim of Sherry Wong, who's using his name and the company's name without his knowledge. In fact, his lawyer told us Sherry Wong quit her job at Cixi Kamba Pharma in June 2004, but kept using the company name for her own independent operation.
Do you think somebody could be making this up for some reason to harm you?
Absolutely, absolutely.
Cheers.
Could Sherry Wong be making up the whole story as part of a slick sales pitch? More about her later. No matter who's behind this counterfeiting operation, the real question is, how do you stop the fakes from threatening America's medicine supply? Aaron Graham thinks there's a solution that could be adopted by legitimate drug distributors.
They can use this device to actually read the bottle, obtain the radio frequency ID number or electronic product code number.
It's a system to put a miniature chip with an ID number on every bottle of medicine, then track where it goes.
So if it doesn't scan, it's not ours.
It's counterfeit.
That's right.
The company Graham works for, Purdue Pharma, became the first manufacturer to put the radio chips called RFID on a medicine, the company's powerful painkiller, OxyContin. And now Pfizer is following suit, putting similar ID tags on Viagra, trying to stop the growing problem of fake medicines turning up in neighborhood drugstores.
The evidence today is that while pharmacies in this country are not awash by any standard with counterfeit products, that there is more getting in now than there used to be.
Coming up, what's being done to protect consumers from counterfeits? Experts say there are some simple things you can do. And we'll learn what authorities are doing to counterfeiter Sherry Wong.
Hi, guys.
Hi. When our Dateline hidden camera investigation, Bitter Pills, continues.
She got part of her life stolen away from her.
Our investigation of counterfeit medicine began after we met the Blount family of Missouri. Maxine Blount was in a life-and-death battle with cancer when she discovered one of the medicines she'd gotten at her local drugstore was fake.
It's bad enough at any point to know you've got cancer and then find out you're not getting the kind of drugs that you're supposed to get. It's devastating.
Over the course of the next year, we discovered just how easy it is for counterfeit medicines to wind up at your local pharmacy. From popular prescriptions like Viagra to life-saving drugs like Tamiflu. Bogus medicines that look just like the real thing, but may not work when it counts.
It's all about money. Criminals are very bright, sophisticated people. They're looking for a margin, they're looking for an opportunity, they're looking for an opening.
We are not happy with the state of the security of the distribution system at this point. We think it can be stronger.
Margaret Glavin is in charge of enforcement at the Food and Drug Administration. She says increasingly the government is concerned about counterfeit medicine showing up in neighborhood pharmacies. And if you shop for medicine over the internet, you're taking an even bigger risk. But none of this is new to the federal government.
The Food and Drug Administration says that over 1 million counterfeit birth control pills have been distributed around the country.
In 1984, there was a scandal about counterfeit birth control pills in America. Congress held hearings and passed a new law telling the FDA to set up a system, so-called paper pedigrees, to track prescription medicines from the factory to the pharmacy. Ronald Reagan was the president. Since then, George Bush, Bill Clinton, and George W. Bush have all named their own appointees to head the FDA. But the FDA never finished enacting the regulations needed to fully enforce the pedigree law because drug wholesalers predicted a paperwork nightmare.
They felt that those were overly burdensome and overly costly for them.
Too expensive.
Yes.
But now, with new electronic pedigree technology available, so-called RFID, will the federal government finally require companies to track medicines from the factory to the pharmacy to protect against counterfeit drugs that have been tainted, poisoned, or just don't work?
They're already doing it with Viagra and OxyContin.
That's right.
Why not the rest of the drugs?
Well, I think that's a very good question. And I think that this show you're doing is really a service in that it's one, telling the American public what they need to do, what they need to watch out for, and two, it raises the profile of this issue.
Are you planning to make RFID technology mandatory?
As I said, we're looking at what our options are to increase the speed with which that technology is developed and the application of that technology to the pharmaceutical supply.
And what do drugstores think about electronic tracking? In a letter, the National Association of Chain Drugstores told us they're optimistic about the new technology, but said it's still unproven. So they're calling for immediate initiatives to strengthen licensing requirements for drug wholesalers. The association representing wholesalers told us they also support stricter licensing standards and harsher criminal penalties for counterfeiters. Pharmaceutical companies are also changing packaging to make it harder to copy. Meanwhile, the federal government says it has stepped up enforcement, and in at least one case, it's paying off. Remember the small sample of fake Tamiflu we bought from China?
It's gone through customs successfully before.
Yes, I promise. I don't need to lie to you, right? Trust me.
To find out more about Nick Yin's counterfeiting business, Dateline negotiated for a larger shipment. But this time when we went to pick up the package, federal agents from the FDA and U.S. Customs were waiting. Inspectors had opened the package during a spot check, and they seized our counterfeit Tamiflu. It's one of more than 100 counterfeit Tamiflu shipments into the United States seized in the last 7 months.
So we could do 6,000 a day.
Yeah.
And what about the Chinese counterfeiter we met, Sherry Wang, and the American scientist who says she's lying about him?
Talk to me about this.
Yeah, you bring her to meet me.
Dr. Boyang Lo says he's willing to cooperate with any investigation of Sherry Wang. But that face-to-face meeting he wants won't be happening anytime soon.
As we speak here today, she's in custody.
She is.
Working with the government, investigators from Pfizer built a case against Sherry Wang and turned it over to Chinese authorities.
They reacted very quickly, very thoroughly, and placed her under arrest. So she has been arrested, and she's in custody right now.
What stage is their investigation at right now?
They're not sharing information with us as the case develops, and that's not unusual. But we've told them what our interests are, and that's identifying the entire network.
But for every counterfeiter arrested, experts say, there are others emerging. So even though officials say medicine in America is still the safest in the world, the FDA is also recommending that you keep a close eye next time you get a prescription, whether you buy online, through the mail, or even at a local drugstore.
I mean, consumers also have some things that they can do. They ought to look at the product. Has it changed color? Does it have a different taste or a different smell? Are the pills cracked or chipped? Does the packaging look as though it's been compromised? Is the label funny? Is it on crooked? Is it different than the label they've had before?
To a common person, you go down to the drugstore and pick that up, it could be full of water. You wouldn't know the difference. We had no idea that what we were getting and having administered wasn't the good stuff. How could we know?
For one family who's seen the impact phony medicine can have, the crackdown on counterfeiters and the new rules to make medicine safer can't happen soon enough.
There's no way you can put a value on it of what it did.
Is this where Mama is?
Yeah. Got a little granddaughter in there.
She didn't get to spend a lot of time with her. We're an average family. But that it happened to us. It can happen to anyone.
You'll find more guidelines on how to protect yourself from counterfeit drugs on our website. Just log on to dateline.msnbc.com.